See, one of the biggest problems that I've seen is that we don't teach people how to solve problems. We teach people how to not get in trouble. How do I know this? Well, I've spoken to a lot of people in the healthcare industry, and I've asked them, what are the issues that you continue to see? What I've discovered is that there's a very similar pattern between many of these conversations. And I've come to realize that a big part of the problem isn't just access to care, it's how healthcare professionals are being trained. Doctors and nurses are taught a very specific way of treating disease. First, they're guided by regulations and policies that limit what treatments they are allowed to recommend and what treatments they're not. Let's talk about how they're being trained. Medical school is rigorous, and rightly so. I think we all want skilled professionals taking care of us. But for the most part, we don't realize that the medical education system isn't neutral. From the first semester, students are taught to follow evidence-based guidelines. But here's the catch. Those guidelines are often shaped by regulatory bodies, insurance policies, and pharmaceutical interests, not just patient outcomes. Curriculums are largely funded, influenced, and approved by large institutions. And those institutions are deeply intertwined with the pharmaceutical industry. Doctors are trained to follow standard of care protocols, which are essentially flowcharts. If a patient has symptom A, prescribe medication B. There's very little room for individualization and even less room for innovation. Now, that might make sense in a high-pressure ER scenario, but for chronic conditions or autoimmune diseases, or even neurodegeneration, this rigid one-size-fits-all approach fails a lot of people.